What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host, Dr. Keoni Tita. Keoni, how are you today?
I'm doing good. Hi, everybody. Thanks again for listening to us. I mean,
Yes.
we're in awe of that and appreciative.
Always.
Yes. Today we want to talk about a topic that is really relevant to what's going on right now. All of us all over the world are being affected by this pandemic, the coronavirus, COVID-19. But as I tell all my patients, anytime there's a viral illness going around, you really do not want to get any type of virus because there are some sequelae that come along with that. And in particular to the coronavirus, there's actually a syndrome. They have a name for it. It's called long hauler syndrome. And this is basically a more specific term for other illnesses, which is post-viral illnesses. But this long hauler syndrome is specific for COVID-19. So that's what we want to talk about today. What is long hauler syndrome? How can people deal with that?
Yeah. So, it's something I haven't heard of till now.
Okay.
Seeing these notes.
I have quite a few patients actually, Bryan, with this condition now. Yeah.
Okay. So that means the patient had COVID before.
Yes, mm-hmm. They definitely had COVID before, and they are no longer testing positive for it, but now they have all these like mismatched full gamut of, symptoms. Many of them are very general. Many of them are very strange. And a certain percentage of people get them. And there's really no rhyme or reason why some people get these symptoms and others do not. But this is not unheard of in the medical literature, right? So a lot of people think like a post-viral type syndrome that comes from being infected from a virus like, mm-hmm. EBV virus, or it could be like some of the other like MERS or SARS or anything like that. There's a high percentage of these people that get what's called chronic fatigue syndrome. So this is not a new phenomenon. You get a virus and then a certain percentage, have to deal with all this other stuff afterwards.
Right. Now, does long hauler syndrome, is that specifically coronavirus?
It's specifically coronavirus. And basically what they're saying is these symptoms, if you're a long haulers, if after you test negative or no longer sick, you have symptoms that can last for weeks, months, in some cases, at this point, for a year or so. We mm-hmm. don't know where the end is with that.
Right.
So they still have symptoms, but there's no consistency or reason why they really do. We don't understand what's actually going on. They estimate about 10% of the people who get coronavirus will become long haulers. And it can infect anyone. It can be, young or old. It can be healthy people or people that are battling other conditions. There's no like definitive thing that we can really say. I mean, for some people to get hospitalized, are they more prone to long haulers, or other people who are really healthy who didn't get hospitalized? No, that's not necessarily true. It doesn't mean if you get hospitalized that you're more likely to get long hauler syndrome. Unless you're, you may have some sequelae if you had to get put on a ventilator, but still, there's just no big rhyme or reason with it. We do know this. We know that COVID-19 tends to be more lethal to men than women, but long haulers tends to be a little bit more predominant in women than men. And it seems that ratio is like 4-1, which is the exact same ratio of chronic fatigue syndrome after a viral illness, which is very interesting.
Yeah.
So what are some of these symptoms that we're talking about? Well, they tend to be really general symptoms. One of the biggest, what's the main complaint people, bring up to their healthcare provider most of the time? It's fatigue. Well, that's a big one. Right. Chronic coughing, ongoing body aches and pains, and they can move. These aches and pains can move around or be localized. Shortness of breath. You've heard of the loss of taste and smell, right?
Right.
With this illness.
So far, these are all continuation of COVID symptoms. No random new symptom.
Well, no, you can definitely have random new symptoms that seem to pop up. Difficulty sleeping, headaches, brain fog, debilitating ringing in the ears. It doesn't necessarily have to be debilitating, but all of a sudden you get ringing in the ears.
Interesting.
Skin feels like it's burning, vertigo, a lot of neurological symptoms, and it just runs the whole. I mean, look up any book with symptoms, and you basically can see anything with this, and that's what's so confusing about it, right? For
Absolutely.
people. And
Yeah.
this is a condition that really wasn't I don't know, discovered by doctors or healthcare providers or researchers. It really came to be prevalent by people talking on the internet about it. People who've had COVID and be like, on chat rooms, hey, I'm dealing with this after I got over my illness, yada yada yada, and then there's seen to be something coming from it.
Yeah. It's going to be interesting to think about medicine in the future. It's things because we have the ability to exchange that type of information consistently, constantly
Right.
with these new pandemics and new things going on like this.
Right. It does seem, there is some information that we do know, though. Like, we do know that um, people seem to have certain areas that are being like affected, or certain things that are showing up. Like, we are seeing like endothelial damage, persistent inflammation in the endothelium, like microvascular damage. Um, and there does seem to be like a bit of an autoimmune component, and definitely neuropathy. One of the big symptoms that I've heard of in my clinic is brain fog. I mean, it's just, something like, and so from a naturopathic perspective, you can think about that as, inflammation, like a little like chronic inflammation in the brain
Right.
can create that. But as I said before, the post-viral fatigue syndrome has been seen a lot in a lot of viral infections. So SARS, we saw it. We there's documentation that you see similar things like long haulers. They documented stuff with the Spanish flu, SARS, that Hong Kong flu. You saw a percentage of people reporting all these symptoms after they recovered. The 2009 influenza A, H1N1. Again, you see that too. Ebola virus. You see like some of these post-viral symptoms, especially the fatigue syndrome.
And so, what do we think this is due to, Keoni? Just different people's interactions with different viral loads?
Yeah, I think it has to do with the person's terrain for the most part. All right, and what I mean by that is I think it has to do with people um, being already immunocompromised. And what I mean, maybe they don't have. This is a guess, so this is not research, but maybe they're not vitamin D replete, right? Maybe um, they have a poor diet.
Right.
Maybe they're not, sleeping enough. That maybe they don't have, as we call in Chinese medicine, their wei qi built up, like their immune system qi built up, and they may be more prone to this. Maybe they already have conditions that make them more prone, right? Where they have like dysautonomia or something like that, or they already had some annoying ringing in the ears or something, and now it's like much worse,
Right.
because of that. I think the virus seems to have an ability to affect like people's weaknesses.
Right. Right. Certainly makes sense.
Yeah. So, and that's one of the ways I go about treating it, right? So anybody who gets coronavirus, I will say right away, if you have it and you're not supplementing with stuff, you need to definitely start doing that right away, because
Right.
I believe it's going to prevent long hauler syndrome for you. And it may even help you get over it more. And I'll talk about it a little bit more, but we've talked about this on podcasts. Okay, are you taking vitamin D? Are you taking vitamin C? do you have some vitamin A on board? Or do you have plenty of zinc on board? And do you have plenty of zinc? Are you taking that zinc with an ionophore, which I'll talk about in just a minute, that helps zinc get into the cells?
Okay.
And there's some natural things with that. So we'll talk about that in just a second. So as I was saying, it really is difficult to diagnose. I mean, the symptoms are common and they're varied and they're all over the place. And conventionally, how do you treat it? Well, they don't really know, but in conventional medicine, how do you really treat anything? You come in with a headache and maybe it's a part of this syndrome of long haulers. What do? They just give you headache medicine, right?
Right.
So let's say part of your issue with this long hauler syndrome is that you're nauseous or maybe even throwing up. They give you a medicine to kind of suppress that, or you have joint pain. They give you a medicine to suppress that. But from a natural medicine point of view, you really, you treat the person and also the symptoms from a natural perspective, but you also treat the gut terrain to make sure that, you're trying to build the person up so
Right.
that they can get the last vestiges out of their body of the not necessarily the virus, but of, the symptoms and the syndrome, right?
Right.
So if the nervous system is the one that's really being affected bad, let's say after you had coronavirus, you become, I don't know, slightly ataxic. You're feigning now. I mean, I've had some people that where they feel like they're feigning, or they get out of breath really easily. But anyway, so if those are the three, they get out of breath really easily, and they're feigning. What are some of the things that I may do? Well, I'm going to think that there's probably some nervous system inflammation going on, and I would treat it with natural anti-inflammatories that can actually help quell that.
Right.
And
now, is
then,
the only way you're going to make the diagnosis or kind of the jurisdiction that someone falls under this syndrome positive for COVID continuation of kind of this strange possible list of symptoms?
I mean, my best way to even go there is there's doc, I just these are the symptoms that I've had, and I've had it ever since I had COVID. I mean, they just popped up,
Right.
And then I just assume, and they're not getting any better.
Right.
And from a conventional standpoint, a lot of the healthcare providers are just sending them home and just being like, well, just go get some rest. Well, the reason why I want to do this podcast is because I think there's a lot more you can do to help some of these people get over it quicker.
Right. Yeah, absolutely. And one of them that we hear about, the kind of that lasts a little bit more, that I've heard about lasting a little longer, is the taste and smell. So do you have any natural remedies or kind of recommendations for that, if that was the thing that was sticking with you for a while?
Yep. Well, again, you can think about taste and smell kind of being like, it's part of the nervous system there. So you can think about maybe there's some type of inflammation going on there. There's some research on making sure people are zinc replete for enhancing taste. It's making sure that people are actually concentrating on what they're eating to enhance the flavors and using their whole palate and smell. For a lot of people, this comes back after a few months, weeks, or whatever. But there are some people that still are having trouble with difficulty taste and smell, which is pretty miserable. I mean, imagine going through the rest of your life being cursed without being able to taste or smell anything, and it's quite dangerous too. I've read a story where a woman almost killed herself because she couldn't smell the gas coming off her gas stove, that was turned on, So, but you basically look at what are the symptoms, connect the dots for why those symptoms are happening.
Right. What system?
And what system, can help bring that about. We were talking about the GI tract, supporting that, support the lungs, decrease inflammation, that type of thing is what I tend to do.
Yeah.
The other thing I just want to say that, and a lot of people may not realize this, is not only is there a post-viral type illness, but also you do see things that after like traumatic intensive care, if you're in intensive care from a traumatic injury or illness, that these people, it's called post-intensive care syndrome, have similar issues. It's almost like the body becomes super stressed and is just completely discombobulated trying to get back on an even keel, and it can't.
Right.
You know.
Yeah, it makes complete sense in a hospital setting, after surgery or whatever, just in a hospital system setting where you have a bunch of different things going in and out of you, medications, lines, you had an injury, you're laying down, bed rest, all this kind of stuff.
And the mental stress of it. I mean, I'd imagine people would have a PTSD component from having to be hospitalized with COVID at this point.
Yeah.
I mean, that's awful. I wouldn't, you really do not want to be in a hospital unless you really have to be. So the stress of being admitted must be astounding.
Right.
I don't know. So I guess, you kind of ask, like, so what's actually causing this? I mean, like, what does it do to? And I just think it's like an immune inflammatory response that just has run amok, it's, and I know that's not a great way to like place your hand on it and point at something specific, but that's certainly what seems to be happening here.
Right.
So I want to just go over a few studies so people can get an idea of what's going on, as far as, is it studied? And yeah, we do have some studies now. So there's a study out of the Journal of Clinical Microbiology and Infection, 2-month follow-up, 150 adults. And they only had mild to moderate COVID cases. And they found that 2/3 of these people, were still experiencing symptoms. There's an Italian study, 143 COVID patients. They'd been discharged, and about 1 in 8 were only completely free of symptoms, and that's after 60 days.
Wow.
Yeah, so that's kind of crazy.
Yeah, it's a fair amount of time.
Yeah, there's a large survey, King's College of London study. It was basically a survey of like 4 million users in the UK or whatever, that they just answered some questions. Anyway, based on that survey, they found that like 1.5 to 2% still had sustained symptoms after 3 months.
Which is more or less the same statistic as the Italian study.
Yeah.
Obviously different levels of research, but similar findings.
Right. And you find these things happening with, as we said, with other viral illnesses. Let's see, the retrospective multi-center study. This was in the Lancet. 55 recovered non-critical patients found that over 60% of patients had persistent symptoms 3 months after discharge. While also in this study, 70% had abnormal findings on their lung CT scans. So let's just talk about that, because we know that's how the virus kind of really causes its damage and where its lethality is. I mean, just the damage it helps, does to the lungs. So one of the symptoms, usually, a common symptom of this long haulers is just having persistent shortness of breath. You don't have to. A lot of people don't, but where they just feel really out of breath walking upstairs. And you do find that, after they have this illness, that a lot of people do have like lung fibrosis. They have some scarring of the lungs.
Yeah.
And you hear, like, it's very, very rare, but you hear these horror stories where people are now up for lung transplants. They've gotten over the illness, but the lungs have just been devastated from it.
Man.
Yeah, it's awful. And I also want to make clear that don't think that you are out of the woods just because you're young. I mean, I was talking to a nurse who, she's not on the COVID floor, but she works at the big hospital here in Winston, and she says, I walk down that COVID floor, I see people on vents. It's not just the elderly; it's people of all ages that are on the ventilators.
Yeah, that's exactly what Haley's saying too.
Yeah. So so it's, it's really no joke, because I hear people, I've heard things in the media like, well, we ought to all just, all of us are going to be infected eventually, why don't we just get infected? Well, no, because you're talking, not only is that a problem, it can, that may kill a very low percentage of people, but still, it still can be lethal. But
Mm-hmm.
also now you're talking about high percentages of persistent symptoms after this, which, that also puts a little bit of a strain on the healthcare system,
Yeah.
and depending on, what's actually going on with it, and then the other thing is now let's add the mental emotional stress that comes along with this. So now you just had COVID, and I know what this stress is like. So I had to go get tested just the other day because I was around somebody who tested positive,
Mm-hmm.
right? um, thank goodness I tested negative, because, like us as being small business,
Yeah.
men and owning small businesses, it's like if we're sick, we can't see people for
Right.
for 14 days. So you really have to be careful, and then also people have to, may have to go to work. So, you if you are sick, you are strongly prompted to, like, you need to take you should not be at work. Do not spread the disease.
Right.
Like, a lot of
Yeah,
people won't
absolutely.
let you go to work. So you want to do what you can with that. But there's almost like a post-traumatic stress disorder that now comes along. It may be, kind of self-induced, but there is that kind of comes along with this, the stress of having to do all this, not to mention the stress of what we are all going through
Currently.
with
Yeah.
currently,
Yeah,
with just
absolutely.
the state of the world and the state of our country and so on and so on. So anyway, I hope that gives a good kind of like overview about what it is, but let's just briefly talk about what we can do from a naturopathic perspective.
Yeah. What are some things people can do other than go for a good walk?
Yeah. Yeah, and a walk will help.
We'll
That
start
is,
there.
I will say this, one thing I have heard that does help, if people can do light exercise and move while they're having this, that it does help.
Yeah, one of the
Because
biggest fallacies of everything is that we are fragile in times of sickness and things like that,
yeah.
or when we're injured, that you shouldn't be working out or whatever. You
Yeah,
should
you
definitely
can
be finding some way to still be active and
still
just,
still move in a
yeah,
way, because it
move.
will, as long as
Exactly.
you don't do, I wouldn't say do high intensity stuff, but I would say move, try to move, go out and walk. That's one of the things I do with I have a walking group that I do. You know, it's in my part of my exercise group. We walk every day on the weekends, Friday, Saturday, Sunday, sometimes Monday.
Yeah.
But it's just a stroll. It's not really even getting your heart rate up anymore. It's just like, let's go for a stroll. We're going to walk for anywhere from 30 minutes to an hour.
Yeah. Perfuse those lungs in the body with blood. And it doesn't
Right.
have to be difficult. Just like you mentioned,
Yeah.
a
Yeah.
walk is enough.
Yeah. So from a naturopathic perspective, we talked about, okay, treating the whole person, um, which is very different from a conventional perspective, which is pretty much just going to try to help you manage the symptoms.
Right.
So we want to treat the whole person. So wherever the weakness is, so let's say the weakness, you just have all these like weird neurological symptoms. So you have ringing in the ears, you have vertigo, you're fainting and passing out, you have, you're all of a sudden your heart starts beating rapidly, so on and so on.
Hmm.
The way I look at that, and there's testing involved and stuff
Hmm.
like that, that you'd maybe want to do further tests and see, like functional medicine testing, to get a better idea. But as I said before, I see that as inflammation in the neurological system. Okay, so you can quell the inflammation with natural anti-inflammatories like curcumin, like boswellia, like ginger, and to some extent some other things out there, that would help indirectly, like vitamin C, um, to some extent vitamin D, that type of thing. You want to make sure people are replete with that. So if I saw a lab that people are having all these issues and their vitamin D level is really low, yeah, I'm gonna replete them with vitamin D and be like, let's get you on vitamin D, let's get your levels back up, and let's see if the symptoms improve.
Right.
Um, if people are having, lots of digestive symptoms, gasiness, bloating, nausea, anything like that, then I may think about things that will support the GI system. Maybe they're having reflux, anything like that. That could include, probiotics. That could include digestive enzymes aiding their digestion so that they can absorb things better, so that their body can use them better, so that your body can now use different vitamins and minerals that you're getting from your food or even from your supplements. If their symptoms are just really bad joint inflammation, I may do joint inflammatory stuff or just joint support supplement. The common ones people know are chondroit and glucosamine sulfate. Their lungs, support their lungs. To support their lungs, definitely prevent them from getting infected again with all the normal, hygiene stuff, but also N-acetylcysteine to help them break up lung congestion, to replete them with glutathione. We had that glutathione podcast that we did. We talked about NAC there. NAC, I would dose that pretty high, probably like 1,200 to 1,800 milligrams for like a month or so, and then maybe knock it back down to 600 milligrams afterwards. But make sure that they are glutathione replete, and NAC, as we know from that last podcast, feeds that.
Right.
Then you want to do foundational support for immunity. We do know that people who are zinc replete, they tend to have less severe symptoms. So I usually put people on zinc. And there are some certain things. We talked about what's called zinc ionophores. These are basically things that help, compounds that just help get zinc into the cells. So quercetin is one of these things. It's a natural thing that's found very high in onions. EGCG, that's a natural compound that's found in green tea, can also help. To some extent, vitamin C can help that also. And then just general immunity, I actually will use herbs. And one of my favorite herbs to use is called astragalus. And in Chinese medicine, they give combinations of astragalus and formulas. That's like the main herbal ingredient to protect people from getting affected from viral illnesses. So there's a product called Jade Screen. Basically, it's like it boosts your Wei Qi, boosting your immune system by giving astragalus to prevent you from getting the infection in the first place. And then just to kind of clean up any other viral illnesses that may be contributing or have come out to play after you've been weakened, your body's been weakened from the coronavirus. There are natural antivirals out there. Again, there are herbs like andrographis, olive leaf, echinacea, licorice extract. So these are kind of like the general things that I use, but I use objective data to see where the weaknesses are, though. So I'll do some testing if we need to, to find out what I need to do instead of throwing a trash bag full of supplements at people. Right. And a lot of times I will be like, well, what is the main thing that is causing the most issue there?
Right.
For one person, it was like severe ringing in the ears. So, I use ginkgo biloba to help with that. There's some research that says that it can help with. There's some other things that can help with that too, especially Chinese herbal formulas. But a lot of people have heard about ginkgo biloba, and it does seem to help with ringing in the ears, and also acupuncture. Acupuncture can help with that too.
Yeah.
But before we go, I mean, I want to sum it up by saying, there's a lot we don't know about this illness. We do know long hauler syndrome is a real thing, so you're not going crazy. It kind of falls under that post-viral illness umbrella. And bottom line is that you really do not want to get any viral infection. And if you do get COVID, then that's when you really should start treating your body from a natural perspective, kind of persistently and with more impetus to make sure that you prevent this long hauler syndrome. And for some, if you need direction, it can be as simple as be like, okay, let's just make sure that you're taking your zinc and your NAC, and let's make sure the zinc's actually getting into the cells. and that you really want to support your body as best you can. So the simple things are powerful: walking, plenty of sleep, plenty of fluids, that type of thing,
Right.
will help. What does not help is, okay, you feel like, a lot of people get a positive test and they don't really feel anything. Well, you're not out of the woods. You may not feel anything, but you also may get long hauler syndrome.
Right.
So there's no rhyme. What I'm saying is there's no rhyme or reason why some people get it and some people don't, based on the severity. It just isn't, with the exception of the lung issues, it seems.
Right. And
So
so from the get-go, you need to be managing it regardless of symptoms.
right, you
Yeah.
do. And I would say that based on what we know about how viruses work in the body, I would say that you should do that with any viral illness that you catch,
Yeah.
including influenza, anything like that.
Is a astragalus, Keoni, something you could take with like regularity? As cold and flu season peaks up, can you start taking that with with
Absolutely.
regularity?
You can,
Okay.
yeah, you can. I've given my patients like astragalus. They look like the raw astragalus herb looks like little tongue depressor. They're
Hmm.
like strips of wood of astragalus,
Uh-huh.
they're like little flat things. And then you can put them in water and boil it and drink that tea as much as you want. It's a very safe herb to use. In Chinese medicine, they use astragalus a lot in their cooking. Like, it adds some flavor to chicken soup and things like that. Herbs
Awesome.
that's a very, very safe herb. It's actually considered a longevity herb, and it's very cheap too. So it's a
Awesome.
powerful herb.
Okay. Yeah. Awesome.
Yeah.
Anything else that we didn't mention, Keoni? We wrap up
I
here.
don't I don't I don't think so. I think I hit on everything that I wanted to hit on. Anyway,
Awesome.
thanks everybody for listening to us once again. I hope this helps.
Yeah, absolutely. And I'm all it's lunchtime, Keoni, so I'm off to eat the Well Man's podcast salad because I've got that prepped for this week.
Okay, yeah, I got to make one of those myself.
All right, everybody. Thank
All
you for
right,
listening. We'll talk with
take
you next
care.
week.
All right, bye.